The new channel. The new channel. Hashtag TNC Now.
The views, opinions, and insights expressed in the following shows are those of the host, producers, guests, and viewers. They do not necessarily reflect the position of the channel. Viewer discretion is advised.
Hello and welcome to the new channel. Our passion transforms an entire community that sees all things new. I am Gianne Janiola, streaming live from the City of Pines with a very special guest, all the way from the summer capital of the Philippines. Join me this afternoon for the premiere of the Frontline, only here on TNC. Hello and good afternoon to everyone who is watching us right at this moment. Tonight is a very eventful evening as we talk about the struggles of our frontliners who are really at the forefront of this pandemic. Now, let me welcome our special guest for tonight. She is a graduate of Bachelor of Science in Nursing, currently working as nursing supervisor under the infectious disease department here locally in the Philippines. Please all welcome Ms. Czarina T. Mendoza.
Hi, Gianne. Hi, everyone. To all the healthcare workers and to all the frontliners around the globe, hello. And of course, I cannot forget the management and staff of the new channel. It's an honor and privilege to be a part of this program.
Hello, Ms. Zar. Now, I know you're a very busy person, so I really want to thank you for being here this afternoon or tonight, I should say. It's such an honor to have you right at this moment. So now, the talk about COVID-19 has been on the forefront of our feed for the past year and even this year. So, however, it is a topic that would not go away. So kahit rinding-rindi na talaga tayo sa topic na yan, it's really here. It's the truth. So it will not really go away in an instant and definitely will be part of our history. So can you give us an update on the current trend of the disease?
Okay, Gian, I'd like to share my slide for my intro on the COVID-19. I know everyone is well equipped with what's COVID all about. So let me just share some census.
Mm-hmm.
Thank you, Gian, again. Thank you for having me here.
It's our pleasure, ma'am. No
All right.
worries. We're really happy to have you here.
All right. So as of today, November 15, 2021 at 5 o'clock
Mm-hmm.
p.m., we have a total confirmed cases around the globe of 253,336,073 and
Mm-hmm.
reported deaths of 5,100,760. So in the
Mm-hmm.
Philippines, my source is Department of Health. We have a total of 2,816,980 confirmed
Mm-hmm.
cases, reported deaths of 45,581. And the great news is that mas marami pa rin ang recoveries natin compared to deaths, which is 2,743,297 with active
Mm-hmm.
cases of 28,102.
Right.
So we have to be, we know already about the COVID-4 dominant COVID variants around the globe. So that's Alpha, that's Beta, that's Gamma, and the Delta.
Mm-mm.
So we know that the very dominant variant as of today is the Delta variant. Although sa lahat naman ng countries, meron tayong mga iba-ibang variants.
Mm-mm.
So what's new? We have this sub-variant of Delta, which is the uh, AY.4.2, which was discovered in Britain. So as of now, it's not considered yet as a variant of concern, at least
Mm-hmm.
in some countries. But when you watch or read the news on Europe, masyadong dumadami na ang cases nila ng Delta Plus. So I hope it will not hit every country in this globe.
Mm-hmm. So far, Miss Zar, wala pang case neto dito, right?
Yes, yes.
Oo.
So, but just like any other variant, it's just around the corner. So, nandyan lang siya. Kung papapasukin natin, sana wag. So, we have later on my slides, I will be talking about the preventive measures, which I know, sabi mo kanina, rinding-rindi ang everyone. Okay,
Mm-mm.
so in the context of COVID-19, where are we now? Where do we want to be? And how will we get there? So still, the threat is there. COVID threat is still there. And where
Right.
do we want to be, diba? We want to be back to normal. So lahat naman gusto
Mm-hmm.
balik tayo sa dating sitwasyon kung saan wala pa
Mm-hmm.
yung COVID. So how will we get there? Talking about hierarchy of controls, so we have the elimination, substitution, engineering controls, administrative controls, and the use of the personal protective equipment. So everyone, lahat po tayo ay kailangan nating gawin ito. Everyone is
Mm-mm.
involved in the management, treatment, and especially prevention of COVID-19 virus. So when we see elimination, physically remove the hazard. So ang sabi natin now is getting ourselves vaccinated. So vaccination for the engineering controls, lahat naman, no, not just in hospital settings but also
Mm-hmm.
in public places where we put barriers, one-way traffic, the exit and the entrance should be different. Lahat ng establishments naging very conscious about the hand hygiene facilities or the hand washing
Mm-hmm.
sinks, or we have this alcohol-based hand rubs in every entrance and exit of all the facilities. So administrative controls, the WHO, the CDC, the DOH, hindi po sila nagkulang ng pagbibigay ng ating protocols and guidelines in the
Okay.
context of COVID-19. So for the personal protective equipment, syempre, Gian, no, nakita mo naman,
Oh,
it's different kung ano ang
yes.
ginagamit ng mga healthcare workers personally caring for or directly involved in the care of COVID-19 patients. But
Correct. Oo.
generally, if we speak of personal protective equipment, we talk of the most basic. Ano yon? That's hand hygiene and of course the use of our surgical mask and our face shield, especially when
Mm-hmm.
you're inside enclosed spaces or enclosed settings. But the gist here is dapat ang paggamit natin ng personal protective equipment should be worn properly or appropriately because there's no use of using surgical mask or your face shield if it's not worn properly. So, di ba, for our surgical mask, it should cover our nose and our mouth.
Oo, correct. Kasi ang daming naglalakad, they are wearing their mask pero nandito sa chin nila, no? So it's
Yes.
very important then for them to be wearing, not just for compliance.
Yes, that's correct. So we have to wear it properly for us to be well protected against this virus. So talking of COVID-19, we have to note that the mode of transmission is still airborne. So nasa hangin po yan. What else? Droplet. Umabahing yung katabi mo and then you can be infected. And of course, contact. So if you're not observing proper hand hygiene, then you can possibly be contaminated with the virus. So this is preventive measures or a reminder done by the infectious disease committee of our hospital, which G is also in. So when we
Mhm.
say P, we have the use of personal protective equipment. Again, that's our mask and our face shield, or our
Mhm.
goggles. That's for healthcare workers.
Mhm.
So for regular hand hygiene, oh ayan, at least if there's one good thing that this pandemic has brought us, everyone, not just the healthcare workers, lahat-lahat in general, is naging very, very conscious tayo on the practice of hand hygiene. So lahat na, di ba,
Oo.
naghugas na ng kamay, lahat
Mm,
na
correct.
may dalang alcohol sa bag. So kahit saan pumunta, at least they
Oo.
practice hand hygiene,
Hand
which is very
hygiene, yes.
important. Well, in the prevention of not just COVID virus or not just COVID virus, but in general, all infectious diseases. So wag po natin kalimutan yan. And I'm very, very particular with that, Gian.
With
So,
that process, no, yung
yes,
hand hygiene talaga,
hand
yes.
hygiene. Kaya dapat tinuturo natin yan sa mga kids natin at home. So
Oo.
that paglaki nila and then eventually they become healthcare workers themselves and they know very well what is hand hygiene. What
Ayun.
else? Ensure good ventilation. We have to
Mm.
open our windows. Well, of course, in the hospital, we recommend open ventilation. So we have to open the windows of our rooms, of our isolation rooms. Although we have rooms which are negative pressure. But in our
Mm.
homes, please practice this one. Pag nasa bahay po tayo, open tayo ng windows natin para magkaroon ng circulation sa bahay.
Ventilation.
Yes.
Correct.
Well, V stands for vaccine save lives. We're an advocate of vaccination. So I hope we all get vaccinated. Sabi ko nga kanina,
Mhm.
that's part of the elimination control. So
Mhm.
for those who are not vaccinated, I hope you get yourselves vaccinated because vaccines again save lives.
Save
And it's
lives.
very, very effective. Eliminate microorganisms. Well, that is, the practice of cleaning and disinfection, especially of the highly touched surfaces in our homes and also in health facilities. So you have to regularly clean or disinfect those. Okay, for letter N, anong sabi natin? Know or limit face-to-face group
Face to
activities.
face.
So, well, holiday season.
Oo
S-
nga.
So, sana
Maraming
malimit
kainan
pa
yan.
natin. Yes, maraming kainan. So, hindi na nawawala na ng consciousness ang iba, no? Maraming
Mm.
bisita. So, let's be very, very careful with that. The travel restrictions, especially going to places where there is a really an active transmission of COVID virus. Although lahat naman, no, parang halos lahat meron na tayong cases. So if it's not necessary, then please stay in your
Stay
homes.
muna. Oo.
Yes, and then isolate yourself and seek consult if you're sick. If you're having
Mm.
these symptoms, cough, fever, and colds, kasi nga, minsan ang mentality ng mga tao is sipon lang 'yan. And
Oo,
then
oo.
eventually, 'di ba, nagiging severe, nagiging malala na. Saka pa lang
Right.
sila magpapa-check-up.
Tama. Kahit pre-COVID, may mga ganong eksena, eh. Pagka
Yeah.
talagang hindi na makagulapay saka lang magpapa-check-up.
Yes, correct. So dapat maging conscious din tayo especially when it comes to our health. So
Mhm.
hindi lang po sipon 'yan, it's, better be safe than sorry. And yeah, observe physical distancing, especially when you're in public places, public transport. So please do that. Well, in our hospital, di ba, Gian, we do not encourage, or in any health, any facility.
As much as possible, yes.
Yes,
We
much as
avoid eating
possible, no
together.
eating together muna.
Mm.
Break muna. So that's for our preventive measures.
Mhm. Well, thank you, Miss Zar, for all those updates. At sana, to all our viewers, sana may napulot kayo na tidbits ng information. I know, paulit-ulit itong sinasabi, but it really helps. It's very important. Now, Miss Zar, mabalik tayo sa'yo. So, as a nurse dealing with COVID patients on a day-to-day basis, can you share your experience and how this played an impact in your life?
Gian. And yes, first of all, I would like to express my utmost gratitude to our fellow healthcare workers and frontliners around the globe. Thank you so much for your services. Okay, truly being someone dealing with COVID patients is never an easy job. It's never an easy task. So every day is a battle. Alam mo yan, Gian, no?
Mhm.
Every day is a battle not just for healthcare workers, not just for frontliners, but also for our patients and their families.
Right.
Donning
Mhm.
or putting on our personal protective equipment and doffing or removing them is always a challenge, because you have to make sure that you're doing it right all the time. So lahat ng oras dapat you should be very, very conscious and cautious in every aspect of care that we give to our patients.
That's
So
right.
any breach in infection control could cost your life, the life of healthcare workers or the life of the healthcare providers. And with and with that, we really have to be very, very careful. So we sweat inside our personal protective equipment every day. But beyond that is also feeling the pain and the struggles of our patients. So
Mm-mm.
alam mo yung struggle na hindi lang personal, but you also feel your patient. You also feel their pain. You also feel their longing to their family members, because to be isolated is never easy. 'Di ba?
Mm-hmm. Correct.
Malulungkot ka ng bonggang-bongga. So,
Yes.
yes. Well, it can also be very emotional, especially for our patients who long for yeah, again, for who long for the presence of their family. So the
Yes.
brawl is real, but at the end of the day, the most fulfilling part is sending our patients back to their loved ones. And of course, at least at the end of the day, you have made a difference to someone's life. You have touched not just the heart of the patients, but also their families. So for that, yes, truly, we are making a difference as healthcare workers or as frontliners. So this, no, Gian, personally, this pandemic has taught a lot. But I believe na hindi lang ako,
Mhm.
but every human being living on this planet. Well, I have personally felt and seen how far I can get in terms of what I can do more. So
Mm-hmm.
minsan kasi, especially when you're a frontliner and pag maraming tao na umaasa sa'yo, you have to be very strong
Oo,
because they
tama
look up
yun.
to you,
Oo.
no? They draw their strength from you. So
Mm-hmm.
I have realized the real meaning of resilience in every aspect,
Mm-hmm.
physically, emotionally, and mentally. So, but there is really one thing that I have learned and I have embraced is to never give up on my faith.
Mm-hmm.
My stronghold to my spiritual belief made me even stronger. And up until now, that's the reason behind my smiles and behind, despite of all of these challenges. So back to you.
Ayun. Wow, very inspiring. Talagang nadala ko doon, Miss Zar. Thank you so much for that sharing. And yes, I also do feel in behalf of all the healthcare workers, I also do feel the same struggle inside. And then also, Miss Zar, one more thing that I would want to ask from you is that what could be your reaction? Kasi recently, not just recently, even last year, no, this talk about appreciating the frontliners, frontliners, healthcare providers in general, we know that their struggle is really unparalleled, right? Now, how would you address people who would say that appreciating, giving regard to our healthcare professionals, especially during the surge, the ECQ last year, how would you address those people who are saying that, hindi dapat natin sila, we're not supposed to treat them special. Appreciating them is overrated. Comments such as, trabaho naman nila yan. So, hindi dapat sila magreklamo. Ginusto nila yan. They're being paid to do so. So, why the regard for these people? How would you address those types of comments?
Well, most of the time, especially when you're really in the front line, yung araw-araw
Mhm.
kang nandoon, braving the battle and giving all of you, yung ginagawa mo lahat ng sacrifice and then makakarinig ka ng ganon, it's very, very demeaning. Masakit sa loob. But at the end of the day, hey, this battle is not just about me. This battle is not just about the healthcare workers, but this involves everyone. So
Mm-mm.
yung mga nagsasabi ng ganon, well, at some point, baka mamaya because it does not select. So all walks of life,
Mm-mm.
natatamaan siya. But
Mm-mm.
anyway, thank you for all those who appreciate the efforts of frontliners, the healthcare workers. Thank you. Thank you so much for that. Um, for those people na medyo ano pa rin, hindi pa rin masyadong convinced and saying na trabaho mo naman yan. Masakit, pero that's part of it. That's part of it. So for the healthcare workers, for my fellow frontliners, sana we draw strength from that. Dapat mas maging strong tayo because kung masyado tayo naaapektuhan, sisip-sipin niya ang ano mo, ang mental and physical strength mo. It
Mm-hmm.
will not help. It will not help. So just shrug our shoulders and move on. Just do what we ought to do.
Wow. Ayan naman. So, thank you so much, Ms. Zar, for your time. Definitely. For your time tonight. I know you've been traveling the whole day just to really make room for this episode. And thank you so much for sharing straight from the heart. So, this past year and this year, we have lost a lot of people. Some are even close to our hearts, some are even close to home. But guys, to all our viewers, let us not forget that we are blessed, and you being here tonight watching Miss Zar, watching us on the front line, in itself is a blessing. We that you are alive, you're right there sitting on your couch, or you're probably on your way home watching us, you're alive. So bless you on that, diba? It's such a blessing at this very moment. So, Miss Zar, would you want to thank anyone for tonight?
Again, first of all, I'd like to thank you and to all the staff and management of the Frontline. Thank you for having me. It's such an honor. Well, to all the healthcare workers, I know you are physically, mentally, and emotionally exhausted, but
Mhm.
please hold on because you're doing such a noble job and you are making a difference. My salute to all of you. To all the healthcare workers who braved their life and went ahead of us, thank you so much for your services. And yes, rest well in the arms of our Creator. And to everyone, this pandemic is far from over. Please do not let your guards down. Practice minimum health standards in every opportunity of doing so. Again, may I emphasize, uh, for those who are not yet vaccinated, please
Mhm.
get yourselves vaccinated because again, vaccines save lives. We have to sing a song. We have to sing a common melody together because we can only fight this virus. We can only win this battle if we work together as one. Sabi nila, we heal as one and we fight as
Right.
one.
We heal as one. Ayan talaga. Miss Zar, thank you. Thank you so much for your time tonight. Tapos, maraming salamat sa lahat ng information that you have shared to us tonight. Thank you very much. And really, we salute you for being for being part of the headship of infectious disease, especially also here in Baguio. We're catering to most of the cases north of Manila. So really appreciate those innovative thinking. Napakabilis ng development even in the hospital where we both work in. We really want, in behalf of the staff, I really also want to thank you for that. And of course, ayan, medyo ang bigat, but bigat, but the inspiration is there. But before we go through with that, we only have a few more days before Christmas. Ayun! Asan ka na,
Ayun.
Mar? Ayun. Hi! Merry Christmas
Merry
for
Christmas!
Ayun, 40 days before Christmas. Ayan. At malapit na rin po, TNC will be launching a lot of surprises for this Christmas. So you have to watch out for that. They were very excited to launch a lot of new shows and new new clips for TNC. And of course, Mizar, thank you.
Thank you and congratulations to all the staff.
Ayun. Thank you po. And of course, um, to everyone who is watching with us tonight, it's such a pleasure to have you onboarded with the premiere of The Frontline. Ayan. So, let me see you again on November 29 for the part 2, episode 2 of part 5 of the show of The Frontline. There's only one way to see me again, only here at the Frontline. See you!